All right. So we are pretty much a month out. It's March 29th. Yes, March 29th. And I gotta say, I was kind of slacking at the end of 3 months and at the end of 3 months, at the end of 3 weeks and the end of 4 weeks, because this is pretty much the end of 4 weeks, but it's about a day after. And I want to say, just to recap, at the end of 3 weeks, I was pretty much at full. I pretty much had full control of my legs. I was able to contract it, cause at the beginning, whenever I would flex my leg, it would just shake. It would just tremble. The muscle wasn't forming the way, the way it should, and obviously that was because the patellar tendon wasn't fully healed, and it was still doing a lot of reconfiguring and just everything that goes on in the knee to aid in the healing process. So that's how week 3 was, but I was still able to raise it. Uh, when I did raise it, I obviously felt the tug. I felt the tension in my knee that was basically telling me you can raise it, but that's it. And by that's it, I mean you can only raise it 5 inches. Don't go any higher. Don't try to hold it. Don't do any of that because you will hurt yourself, right? My leg was telling me that by basically giving me pain in my knee the longer I was holding it. But that was an accomplishment for me. When I went to my second physical therapist appointment, that was on the 24th. That was a Wednesday. And she took off my bandage, and my knee looked pretty good. It looked pretty good. Some scarring, obviously, but it looked good. After that day, and at that point, my apologies, at that point, I was able to raise it. I was able to do a lot of things with minimal pain. So now, fast forward past that appointment, every day was just progressing to a point where it was like I feel no more pain, and I'm able to raise it, I'm able to flex it, and I can actually see my muscle coming back, because I work out constantly. I work out like to this day. I've been working out since this injury, obviously not my legs, mostly upper body, but there were certain workouts like planks and push-ups where I had to um contract flex my right leg. Obviously there was overcompensation on my left leg that was carrying most of the weight, but my right leg I had to flex it to the best of my ability and able to be able to perform those exercises, to push up planks and the other exercises that require that type of activity. So now to this day, on this day, the 29th, I can proudly say that my leg has shown tremendous improvement. Like the way I can raise it freely. Also, my muscle in my leg is definitely coming back. As you can see, there's no tremble in my quad muscle, because right here, whenever I tried to flex it, it would just tremble. Like it wouldn't even really show any definition. But the definition is coming back, and as you can see, that's what my knee is looking like after the bandage was taken off. I was washing it because obviously for a whole month there was no washing going on in this area. So it was dead skin, and it was just looking disgusting. So I washed it and cleaned it up a little more. But this is definitely showing a lot of improvement. It feels like my regular leg. Honestly, I feel no pain. The only thing is I still can't bend it because, as you can see, there's still a lot of scar tissue in here. But all in all, I'm very happy. It's a blessing to be healing so fast. Even my doctor said a normal middle-aged person or someone that's very inactive and doesn't like to move a lot, homebody, people that share those characteristics usually don't heal this fast. They usually take literally the recommended 6 months to be able to come back to full operation, like as far as doing daily activities that they couldn't normally do because of this injury. So they would take that long 6 to 12 months, not just 6 months, 6 to 12 months to heal. But me, she said, and I work at Amazon. That's another thing. My job is Amazon, and she said I could be able to go back to doing my regular Amazon duties in 2.5 months. Not from now, like 2.5 months from my injury, whatever date that's gonna be. So I'm really happy for that. So that just means I don't have to be out of work and I don't have to be out of the gym for a extended period of time. Now, obviously, when I do go back to the gym, I'm gonna be extremely mindful. I'm not gonna squat. I don't recommend squatting for the recommended 8 months for anybody, and that's just because giving yourself, it's better safe than sorry. So giving yourself that time period to just stay off the squat machine. Obviously, you could do body weight squats, and then as you get more comfortable and stronger, you can add weight to your body weight squats. So don't have a barbell on your back. Hold a dumbbell. Maybe even add some elevation to add some more depth to your squat as you progress. There's a million other variations of a squat that you can perform that doesn't include so much stress on the knee. There's a million of them. And you know what? I'm going to post some of those as well. So, that's pretty much it. That's pretty much it for this video. I'm going to still keep everybody updated as far as how I feel, how much stronger my leg is going, and just my progression, and also my next physical therapist session. I'm gonna videotape that as well. All right, so everybody stay blessed, have a great day. If you're going through this, I can tell you right now, even though I'm like a very active person and people like me that go through this are very active and heal faster than normal, I can tell you the best way to ease your nerves and heal faster is to do the quad flexes, quad activation exercises, the calf pumps, eat your vitamins. I take joint vitamins as well as my recommended vitamin A, B, C, all the letters, and my fish oils, and I eat bananas. Everything you put in your body is a big factor in the healing process. So be consistent with that. Look on the internet, you'll see all types of foods and remedies and herbs that will aid in your healing process. And in no time, you'll be better. Just keep your head up, stay positive. In the beginning, it's going to be bad, but literally after 2.5 weeks, you're good. All right? Until next time.